Hey YouTube world, today I was trying to get you a video of something I came across today when we're seeing patients, but the patient was kind of reluctant to do a video, but basically what we came across was what called a thrombosed hemorrhoid. So the patient is pregnant and she was about 36 weeks. So just about ready to have her baby and came in. She'd been having some hemorrhoid issues, but it all of a sudden turned much worse. So basically, hemorrhoids are a fleshy, soft skin that sometimes presents at the anus or the butthole in other terms. That can get inflamed. They sometimes get irritated and they get itchy. And sometimes they get irritated and bleed, like when you wipe after a bowel movement. Also, if you're constipated, it can actually kind of tear the side of the vein or the hemorrhoid and cause bleeding at that time. So they usually kind of are intermittently, every once in a while, cause problems. They get swollen whenever you increase pressure, like when you get mad and you have veins that pop up in your forehead, or you've been exercising, more pressure has increased in on the vein side. So blood comes out of the heart through the arteries, and goes to the organs, and then comes back to the veins. The arteries are very strong. The blood comes out, expands the artery, and then shoots it downstream. But the veins are very floppy, and they can hold a lot of blood. So what happens when people have either like liver disease or pregnancy, the pregnancy actually kind of blocks, kind of like a dam effect on the blood coming back to the veins. So the blood comes out real easily through the arteries, goes down lower, but then when it tries to come back up, the baby blocks the blood coming back. And so the veins expand and more blood sits in the vein system. So what we notice in pregnancy and people with liver disease is that they start having enlarged veins, like varicose veins, hemorrhoids, veins that pop up kind of like on the skin of the abdomen, okay? So as long as the blood is flowing through there like a liquid, it just kind of becomes bothersome when the hemorrhoids swell and get irritated. You know, you can use medications to try to shrink the tissue down, but really it boils down to trying to avoid increasing that pressure in the veins. So what happened, but if the blood doesn't circulate well enough, then it'll sit, and whenever blood sits somewhere, it hardens and becomes a clot. So what happened in this patient, would have been nice to have the video of us actually doing the procedure. When there's a clot that develops in the hemorrhoid, people actually come in basically begging for you to open the hemorrhoid and remove the clots, which is not, which creates pain in itself. But it's the amount of pain that they're experiencing that they would actually be okay with doing something like that to that area of the body. So basically, a hemorrhoid is soft. It kind of collapses, kind of a spongy. You can see it kind of on the outside of the anus. There's a video of the Votiva that we use on the hemorrhoids to try to shrink that tissue. So you can shrink it or you can remove them. But if it develops a blood that's sitting there and hardens, then all of a sudden it becomes firm. It starts kind of pushing out more, and it creates a lot of pain, excruciating pain. So, and when you look at one of those, just to touch it, it hurts. It creates tremendous amount of pain. A hemorrhoid, you touch it, it just kind of sinks in. But a thrombosed hemorrhoid is very painful. And actually, most of the time I've noticed is that when you look at the outside of a thrombosed hemorrhoid, it actually looks purple. Because it's just blood that's just sitting there. So that's what we saw. We injected a little bit of local anesthesia. We just made a small incision, and we used an instrument to actually pull out the clots. And so once we do that, all that inflammation goes away. Even though there's a cut there, the patient feels dramatically better. So I'm going to show you what we pulled out of the hemorrhoid. It doesn't look like much, but when you consider how much pain they were under, it's pretty wild how much small clots like this can create that much pain. So inside of the hemorrhoid, we removed these clots. So just to give you an idea, there's the size of my finger, and those are 3 clots that we pulled out of the thrombosed hemorrhoid. So it doesn't look like much, but really brings a patient to their knees. So pretty much they still have some discomfort from healing from the cut, but their pain is totally different. And so usually it'll shrink up as long as they avoid constipation. Her, unfortunately, while she's still pregnant, she's going to have those changes in the circulation of blood in the veins. And so with her, basically, we're going to try to avoid constipation. She should heal up fine, have her baby, and then once the baby's out, the circulation basically goes back to normal, and then things get better. Some women continue with hemorrhoid issues, and that's where we can do either surgical treatment or steroid treatment, or what we've done on our other videos of Votiva. So anyways, that's a kind of a quick discussion in regards to hemorrhoids and when they get really bad and you have what's called a thrombosed hemorrhoid. So would have liked to have a better video for you, but the patient just didn't want to volunteer for the video. But at least we got to show you and discuss the topic and show you what we actually are able to remove with the small procedure. Now, if someone has enough pain control, you can use some topical stuff, and the body sometimes will naturally take care of itself. In a perfect world, it would dissolve the clot itself, and the circulation start back up again, and then it goes away on its own. Or sometimes the skin just opens up on its own, and the clot comes out. So, we gave that option to the patient, but she was in so much pain, she said, take care of it. So anyways, thanks for watching. I'll try to get a little bit more interesting videos coming up, but thanks for watching.